Good evening, everyone, and welcome to today's session. Arun, Meena, Mahidhar, Neha, and many more who are all across the country. So you're all excited a lot about. I did not expect. I thought maybe 5 or 6 people will come. You all have a real courageous heart and a bold spirit to face the examiner. I'm so happy. In spite of exam in another maybe 14 to 15 hours, you still have joined the session. Thank you, doctor. Let us all work together. Now, we are discussing MCI screening test, which is having more or less a similar, it's like a twin sister of NEETPG. Since you are marrying elder sister tomorrow, आज जरा साली के साथ you are having a little date. That is, FMG is like a younger sister of the bride. So let us be very sure, doctor. Now, tibial and common peroneal nerve. Thank you, Arun, for the good faith. So, biceps femoris muscle. So, biceps femoris को 2 heads होते हैं. Long head, short head. Long head is supplied by tibial part of sciatic, short head by the common peroneal part of sciatic. So that's what you need to understand. And biceps femoris, what is the main function, doctor? Flexion of the knee, lateral rotation of the flexed leg, and the long head extends the hip. That's what you should remember. Obturator nerve is supplied by. Please drop a line in all your WhatsApp study groups that the live class has started, so that our other friends can also join in your batchmates, classmates groups, and also our study groups. Please drop a line. Now, doctor, obturator nerve. Already this was a repeated question in the FMG exam. So you have anterior division, posterior division. Along the medial compartment of the thigh, they're all supplied by the obturator nerve. Pectineus, gracilis, adductor longus, adductor brevis, if it is not supplied by the posterior division of the obturator. Even obturator externus, adductor brevis, if it is not supplied by the anterior division, and adductor magnus. So they're all supplied by the obturator nerve is what you need to remember. Ashtak is asking, sir, can we see this recorded later? Why not? Why not? Definitely. If you are really sleepy, please go to sleep, doctor. Please go to sleep, ideally. But some of us are real blood-sucking zombies, so we don't feel sleepy. Jara kuch 150 questions of NEETPG के साथ खेल के सो जाएंगे. So that is the idea. Otherwise, please go to sleep. That would be the best thing. But if you still have that energy and you are that nocturnal eagle, then you can continue, right? Raj is asking, can you come online tomorrow? आपके एग्जाम के लिए को जाते भी मैं रहता हूँ, डोंट वरी. ईयरफोन लगा के एग्जाम हॉल को जाना. So yes, of course it is possible and practical, right? So but that would be too extreme. This itself is extreme. ये hour में आपके साथ I'm feeling guilt that I'm feeling a guilt feeling that maybe instead of you sleeping, I'm disturbing you kind. So please decide if you feel like join, continue. Now, doctor, celiac trunk, what are the branches of it? Very important question, doctor. Same ditto. Either way, there is no surprise. Splenic artery, left gastric, common hepatic artery. These are the three important divisions of the celiac trunk. Celiac trunk से निकलता है left gastric artery, splenic artery, common hepatic artery. So you can easily remember through this picture, just get into your mind. Celiac trunk gives rise to common hepatic artery. From common hepatic artery you get gastroduodenal and proper hepatic. Gastroduodenal gives rise to right gastroduodenal and superior anterior pancreaticoduodenal. Proper hepatic artery gives rise to right gastric artery and the right branch of the proper hepatic artery. The right branch of the proper hepatic artery is going towards the gallbladder, right? So there is a reason cystic artery. And the right gastric and the proper hepatic artery also gives rise to the left branch of the proper hepatic artery. Okay? Now, the splenic artery, what are the branches? Splenic artery sends branches to the spleen, branches to the body and tail of pancreas, short gastric branches, and left gastro-omental artery. So this is one of the favorite questions of the examiner, doctor, be very sure. Left gastro-omental जो होता है, that comes from splenic artery. Right gastroduodenal artery comes from gastroduodenal, which is the branch of the common hepatic artery. That is very important to remember. So at least you remember left gastric, splenic artery, common hepatic artery. These are the three major arteries coming from the celiac trunk. Left gastro-omental is coming from splenic artery. Right gastroduodenal comes from the gastroduodenal. Gastroduodenal is a branch of common hepatic. Common hepatic is the branch of celiac artery. If you take last 20 years of the All India NEETPG, so many times questions are asked on this single important slide, doctor. That's the reason I want you to remember. Barabar? Now, pancreatic tail, where is it present? Keep punching the answers, doctor. Keep punching the answers. Splenorenal ligament. Splenorenal ligament mein pancreatic tail is there. Good to see 100 online zombies to suck the blood of the examiner tomorrow. Right? Good. एक खड़क चाय बोलो और फटाफट खत्म करेंगे at least 300-400 concepts from about 150 questions. That is the plan, right? So it is the splenorenal. Now, doctor, where is gastrosplenic? Name itself is telling you. Stomach is there, spleen is there between the stomach and spleen. So the greater curvature of the stomach and the spleen are connected, right? Between these two, you have the gastrosplenic. Gastrosplenic के अंदर होता है short gastric arteries and gastro-omental arteries. Then kidney है ना doctor? Kidney. Left kidney and the spleen are connected by the splenorenal ligament, which contains the splenic vessels. So the arterial supply of the spleen is from splenic artery. Splenic artery is a branch of celiac artery. You are not going to forget. Now, gastrosplenic, splenorenal, splenocolic. Every time examiner will try to play with you on the same story. So gastrosplenic में क्या रहता? Short gastric vessels and left gastro-omental vessels. Splenorenal में splenic vessels, splenorenal में splenorenal है ना between spleen and kidney. Splenorenal में इसी को linorenal भी बोलते हैं. Splenic vessels रहता, tail of pancreas भी रहता. That's what examiner is asking. Then you have a splenocolic where the lower pole of the spleen is connected with the colon, right? What is a favorite single liner question of the examiner is, if you are doing the splenectomy, which ligament is under the damage, danger of getting injured? So you should remember, it is the splenocolic which is at the danger of getting injured at the time of doing splenectomy is what you should remember. Come on, doctor. Question number 5. Everter of the foot. Who everts the foot? Inverts the foot. Everter of the foot is peroneus longus muscle is the everter of the foot. ये तो बिस्किट क्वेश्चन है. एग्जामिनर इज आस्किंग यू दिस मार्क्ड एरिया को क्या बोलते? रेडियल हेड बोलते. हेड बोलते, लड्डू नहीं बोलते. ये होता है कैपिचुलम. दिस इज ट्रोक्लिया. दिस इज olecranon. You have to be very, very sure. Now, retraction of the scapula at the sternocleidomastoid joint is basically by question number 7. Should your answer, doctor? Let me check how many of you are awake. Ramu, ek kadak chai bolo. Yes. Gangli from Kolkata. Are you from Kolkata? Bardwan Gangli. So Neha ji. Trapezius, not serratus anterior. Be very sure, right? Now, doctor, what are the various muscles that stabilize the scapula? इसके पहले FMGE 2018 जून का पेपर में ही हम रिट्रैक्टर ऑफ द स्केपुला के बारे में सुना. अभी भी सुन रहे. That's reason be careful, right? So, trapezius lead to retraction, elevation, depression and upward rotation. Then rhomboid retraction, levator scapulae elevation, pectoralis major protraction, serratus anterior protraction. So you should be very sure what are the stabilizers of the scapula. Very good. Gangli from Kolkata. So, Gangli, tell all your friends who are all there in your WhatsApp study group. Every day, 2 hours, we have no other work. Live online broadcast across the year. So, ask them to subscribe to this YouTube channel so that they get lots and lots of content and revision. Now, sternum is attached to scapula. How? It is the clavicle. Winging of the scapula, biscuit question. Naru to serratus anterior. Fracture of the upper radius and ulna at the point of insertion of prunita teres. What does it lead to? Obviously, prunita teres को कुछ हो गया तो प्रोनेशन नहीं होगा. ये भी कुछ बोलने का बात है क्या? So that is the reason suddenly when you get such an easy question, no, don't get a heart attack in the exam hall, right? So prunita teres muscle. So you should remember it has one humeral head attaching to the medial epicondyle of the humerus, and there is an ulnar nerve which is attached to the medial border of the coronoid process of the ulna. Earlier we used to run around a big floor and teach to around 600-700 students sitting in the class. Recently I am having pain on the medial aspect of the elbow. मैंने सोच रहे थे क्यों बोल के. So in order to use the pen I need to pronate and use it. So prunita teres, where is it inserted? It is inserted on the medial epicondyle. That is the cause of the pain, right? Now, What is the nerve supply? Median nerve is the nerve supply of pronata teres. Pronata teres not only pronates, it flexes the forearm. Now doctor, golfer's elbow, Shweta ji rightly बोल रहे हैं. Tennis elbow, lateral condylitis, golfer's elbow, medial epicondylitis, as all of you know very well, right? Now, each MCQ we are chasing like a golf ball, that's the reason. So, facial nerve supplying the lower lip. Which one? Obviously, lip is near to mandible, mandibular branch supplies the lip. इसके लिए पढ़ना क्या? जरूरत नहीं है ना? Tomorrow, while writing exam, you will recognize. ये पढ़ने से आंसर करने वाला क्वेश्चन नहीं है, कॉमन सेंस से आंसर करने वाला क्वेश्चन है. A good number of questions require simple common sense to answer. Everything need not be studied. You cannot study also. Lower lip का blood supply कहाँ से आता है? Too much ना? Lower lip, lower is inferior, lip is labial, inferior labial. इसलिए इसको बोलते हैं FMGE, right? So lower lip is inferior labial. Superior labial supplies the upper lip and antero-inferior aspect of nasal septum. Lateral nasal supplies the dorsum of the nose. That is what you need to understand. So fundamentally, these are all branches of what? Inferior labial, superior labial, etc. They're all the branches of the facial artery. Now doctor, what is the landmark of the facial nerve in the parotid gland? There is a tragus pointer. Tragus. Tragus is 1 centimeter antero-inferior. Antero-inferior medial to the facial nerve is the tragus pointer during the parotid surgery is what you should remember. Very good to see 139 online students in spite of the exam. So some of the students WhatsApped me today and said, "Sir, tomorrow morning 10 to 12 आपका class सुन के exam को जाएंगे बोल रहे." I said that would be little therapeutic misadventure. So I don't know. हम तो ready हैं. Because we are unemployed MD General Medicine, कुछ भी काम नहीं है, आपके साथ बैठ के पढ़ाई करना ही हमारा काम है, right? So don't worry, उसको सीट आएगा, इसको सीट आएगा, मुझे आया नहीं आए तो मैं अकेला बन जाऊंगा. आप अकेला कभी भी नहीं बनेगा, क्योंकि हम रहेंगे जब तक आपको सीट आए. So that is the reason, no worry at all, right? Now. This is a beautiful question, Jaya. You just missed it, Jaya. So, hemorrhoids bleeding is the source is superior rectal vein, doctor. Right? Vandan is asking, are you in government service, sir? I am in your service, sir. I am in Vandan service. So, doctor, superior rectal vein. It is the one which bulges and forms internal hemorrhoids. Now doctor, oh my God, Om Rishi is saying 10 to 12 को मैं आता हूँ sir. Definitely. क्यों नहीं? First of all, until I finish 150 questions without getting sleep, if you are awake, definitely my promise is 10 to 12 also. I will give you final farewell story. Now doctor. Portocaval anastomosis is the favorite topic of the examiner, doctor, right? Where are all the portocaval anastomosis? That means one vessel comes from portal, other comes from systemic. Systemic क्या होता है, doctor? Systemic is IVC and branches. Portal, you know now, splenic vein, inferior mesenteric vein form portal vein. So in the lower end of esophagus, left gastric vein and esophagus vein. Esophagus is the systemic part, left gastric vein is the part of the portal. Then lower part of the rectum vein. Superior and middle rectal veins are draining into mesenteric vein. So they constitute portal part. Inferior rectal vein drains into IVC. Finally into IVC. So that is the reason it is a systemic component. Paraumbilically, the paraumbilical veins and superficial epigastric veins. Retroperitoneally, the veins draining the colon and the veins draining the posterior abdominal wall. That is what you have to basically understand. So, doctor, one of the favorite questions is anal canal above dentate, below dentate line. कल के एग्जाम में डिट्टो यही क्वेश्चन आए तो भी लाइफ इज गुड मुझे छोड़ेगा नहीं, हैदराबाद आके मुझे पकड़ेगा इफ आई डोंट डिस्कस दोस 20 एनबीई क्वेश्चंस. नाउ डॉक्टर, अबव डेंटेट बिलो डेंटेट, इसको सीधा माइंड में ले लो, इंट्राथिकली ले लो, एक फुटबॉल ले लो, डेफिनेटली आएगा वन क्वेश्चन ऑन दिस. Nostradamus prediction. Excellent. Embryological origin. Above dentate line comes from endoderm. Below dentate line, ectoderm is what you need to remember. Now, above dentate line epithelium, simple columnar. Below dentate line, stratified non-keratinized squamous epithelium. Stratified non-keratinized squamous epithelium below dentate. Superior rectal artery supplies above dentate. Superior rectal artery is a branch of inferior mesenteric artery. Inferior rectal artery drains below dentate. Inferior rectal artery is a branch of internal pudendal artery. स्ट्रेट अवे सिंगल लाइनर एमसीक्यू पूछेगा एग्जामिनर. देन वीनस ड्रेनेज कैसा होता है? इंटरनल हेमोरॉइडल प्लेक्सस above the dentate line. It drains into superior rectal vein, which drains into inferior mesenteric vein, which drains into portal vein, which drains into hepatic vein, and finally to IVC. सब चीजें फाइनली IVC को ही जाता. One method is through portal vein, other is through systemic veins. Then below pectinate line, external hemorrhoidal plexus. They drain into inferior rectal vein. Inferior rectal vein below the dentate line. They drain into internal pudendal vein. That drains into internal iliac vein, into common iliac vein, into IVC. Into IVC. Gotcha? Then above pectinate line, what is the above the dentate line? What is the lymphatic drainage? Yeah, I know the image is not very clear. Sorry about that. But you have this PowerPoint available in the onlinembbs.com video library. We give a 3-day free pass to the onlinembbs.com video library, doctor. Our whole intention is nothing philanthropic. We want you will like it, love it, and discover that there is no other video library this much extensive. Nobody offers 2 lakh PowerPoint slides, and you will subscribe to us. That is our whole intention, right? Nothing philanthropic about it. So lymphatic drainage, internal iliac lymph nodes above dentate line, superficial inguinal lymph nodes below dentate line. Then innervation also very important. Above dentate line is all typically autonomic. Inferior mesenteric plexus is sympathetic. Inferior hypogastric plexus, pelvic splanchnic nerves, they are all above. Then inferior rectal nerve, which is a branch of pudendal nerve, is the one which is supplying below the dentate line. So doctor, be very, very sure about, right? Now, trismus is due to spasm of am telling you, doctor, one question without definitely on one of the muscles of mastication. एम्स ले लो, ऑल इंडिया ले लो, NEETPG ले लो, एवरी ईयर का ले लो, विदाउट ए क्वेश्चन ऑन मास्टिकेशन एग्जामिनर छोड़ेगा नहीं. आपको एग्जाम हॉल से बाहर आने के बाद ये बात याद आएगा, राइट? डेफिनेटली आस्क अ क्वेश्चन. कम ऑन, पंच योर आंसर डॉक्टर. Trismus is due to spasm of. Question number 15. Shweta, clean bold. Clean bold. Vaidya, clean bold. Radhika, Pichu. Absolutely right. So doctor, please quickly, let's be sure about. Medial pterygoid masseter. Their spasm lead to trismus. फटाफट रिविजन करेंगे क्या ये मसल्स ऑफ मैस्टिकेशन बिकॉज इट इज गोइंग टू कम टुमारो. Masseter, temporalis, lateral pterygoid, medial pterygoid, they are all derived from first brachial arch. That is the reason they are all supplied by mandibular division of the fifth cranial nerve is what you should remember. इसलिए fifth cranial nerve को क्या बोलते हैं डॉक्टर? डेंटिस्ट नर्व. क्योंकि डेंटिस्ट काम करना बोले तो मुंह को खोलना पड़ता. खोलने के लिए जो भी मसल्स चाहिए वो सब सप्लाइड बाय द मैंडिबुलर डिवीजन ऑफ द फिफ्थ cranial nerve. Let us start. Masseter. Masseter is by the masseteric branch of the anterior division of the mandibular nerve. Masseter क्या करेगा भैया? ये masseter है. masseter का एक deep part, superficial part. It lead to elevation of the mandible. Elevation of the mandible. If your mandible is elevated, you will close the mouth. Barabar? Don't forget, elevator of the mandible. Temporalis. Temporalis. Okay, what does temporalis do? It also elevates the mandible. Obvious no, ऊपर से खींचेगा mandible को. Chop, close the door. बोल के. And it also retracts a protruded mandible. एक mandible protrude है तो उसको पीछे खींचेगा. Retraction of the protruded mandible. Examiner clearly asks you the question. What are retractors? What are elevators? What opens the mouth? What closes the mouth? Abba, you should remember. Next, lateral pterygoid muscle. देखो, it has got one nice belly here, one nice belly here. So typically it is the anterior division of the mandibular nerve. It depresses the mandible. Opening of the mouth is because of lateral pterygoid. Closing of the mouth is because of medial pterygoid. Now it protrudes the mandible. Protrudes the mandible. Side to side movement of the mandible. Grinding action. Opposite side medial pterygoid. This side lateral pterygoid, the right side lateral pterygoid, left side medial pterygoid. दोनों मिलके they will move the jaw towards the right side. Ipsilateral lateral pterygoid, contralateral medial pterygoid, दोनों मिलके mandible को lateral pterygoid के side को move करेगा. Right? Then medial pterygoid. Medial pterygoid lead to protrusion of the mandible. देखो, protrusion of the mandible is done by lateral pterygoid and also medial pterygoid. दोनों opposition party में नहीं रहता when it comes to protruding the mandible. But medial pterygoid elevates the mandible, whereas lateral pterygoid depresses the mandible. So lateral opens your mouth. Medial closes your mouth, right? So that's what you need to remember. So कल के एग्जाम में एक मास्टिकेशन मसल आएगा और मुरली भरद्वाज याद आएगा. एक कड़क चाय बोलो. एक्सेसरी मसल ऑफ मास्टिकेशन क्या होता है? Buccinator. Buccinator is supplied by seventh nerve. Typically it is related to molar teeth, pterygomandibular raphe, It action keeps the food out of your vestibule while you are eating, deglutition may, and it helps in sucking and blowing a trumpet. That is buccinator. Now, doctor, parotid duct, where does it open? It opens into second maxillary molar, opposite second upper molar, otherwise maxillary molar. 5 centimeters long, इसी को बोलते हैं Stenson's duct. Fetal midgut का revolution कितना रोटेशन होता है डॉक्टर? फीटल का midgut, it rotates 270 degrees anti-clockwise. That is very important to remember. So doctor, the midgut first rotates 90 degrees and the rotation is counterclockwise and it is completed to 270 degrees. That is what you need to understand. Now the rotation of the midgut, किसको पकड़ के rotate होता? Midgut ने, right? Old movies में there are no bold scenes. 1970s में hero जाके like M.G. Ramchandran, N.T. Ramarao, they used to run to a tree, hold the tree and rotate. They only need to imagine the heroine with a tree. Vaisa, what is the tree around which the gut rotates? Superior mesenteric artery. So doctor, the tree around which the hero will be rotating is superior mesenteric artery, is what you need to remember. It is counterclockwise 270 degrees. Yeah, this NEETPG topper name, flopper. इतना मसल्स डेवलप करना बोले तो NEETPG के लिए टाइम कहाँ मिलता? फिर भी there are some guys who are athletes, sportsmen, also academics may equally good, right? So this muscle inserts into which part is the question? Keep punching the answers, doctor. Radial tuberosity. If any extra point comes to your mind, please punch it. Radial tuberosity gives attachment to biceps, is what you need to remember. So typically radius को एक tuberosity रहता. The biceps tendon comes and inserts into that tuberosity. That is what examiner is asking you. Abba, this is a torture question, doctor. Mammillary body projects via. Who is going to give me the correct answer? Fadafat bolo. Mammillary body projects via. Yes, doctor. Excellent. Gauri Shankar Gautam. Super duper answer. Fornix. Doctor, this is the mammillary body. This is the hippocampus. And this is the fornix. Right? So the hippocampus, thalami, fornix, this is the lateral ventricle, inferior horn. So fornix is this white matter structure leaving the hippocampus, and that projects to the mammillary bodies. Mammillary bodies are there in hypothalamus. You remember that Korsakoff psychosis due to vitamin B12, vitamin B1 deficiency. It is the mammillary body necrosis which is associated with it. So it is very important for our memory. And mammillary body in turn projects to the thalamus. Thalamus is all your sensory inputs go to thalamus, right? Right. Sudhanshu is saying, कल एग्जाम भूत डर लग रहा है और हम तो उससे भी बड़ा भूत गए भाई. इतना मिडनाइट zombies के जैसे काम कर रहे, we are bigger devil than the devil of the exam, right? So, doctor, that is the story of mammillary body. So, limbic system, Papage circuit, very important doctor, examiner के लिए. Which structure connects Broca's with Wernicke? Arcuate fasciculus. This is a beautiful question. Common sense इस्तेमाल करके आंसर करो, right? हाँ. Arun B is asking very innocent question. How many to attempt, sir? Abba. Whatever that you know, attempt it. Whatever you are possibly can be able to guess, try it. What you never heard, don't even touch them. That's a simple rule, right? Now, mediastinal structure of the right lung vein. Which structure is present? Question number 23, punch your answers, doctor. Satya Mitra Chaudhary is saying azygous vein. Satya hai, Mitra hai, हमारे चौधरी साहब. So, उनका आंसर एक्सेप्ट करना ही पड़ेगा. Azygous vein, बढ़िया. So, doctor, if you look at the structure of the mediastinal structure of the right lung, this is the apex. There is an impression where your right subclavian will be passing. This is the arch of azygous vein ka impression. There is a right brachiocephalic vein ke liye impression. Then there is a superior vena cava ke liye ek impression. There is a cardiac impression. Dikh raha hai na? Cardiac impression. Then this is the anterior border. This is the horizontal fissure. This is the middle lobe. It has got a cardiac impression. Then this is the inferior lobe, the base of it. And here you have the pulmonary ligament. Then this is the place meant for esophagus. This is the oblique fissure, and these are the posterior vertebral bodies. We can never forget the thorax dissection in the first year days, no? Pura nikalte do langa. So you have to be very sure, doctor. Right brachiocephalic vein, superior vena cava, उसमें count drain होता है, azygous vein, and this is inferior vena cava. There is a place for all this to come and sit. So that is important, doctor. कल के एग्जाम में bronchopulmonary segment or Counard segment. Without that, there is no question paper, right? Vasa brevia means what? Short gastric vessels. The short gastric arteries को बोलते हैं gastricae brevis, vasa brevia. A little bit of Spanish, Italian भी आना पड़ता. So there are 7 small branches. They arise from the end of the lineal artery and from its terminal divisions. That's what you need to remember. So कितना easy है anatomy? कल का भी 25 questions ऐसा ही होता. खेलते खेलते आंसर कर सकते. No tension. Now doctor, what do you see in intracellular fluid? Magnesium, potassium and protein, they are all found. Resistance against the passive stretch. Passive stretch is called tone. Spasticity is a sign of pyramidal tract lesions. Rigidity is a sign of extrapyramidal. What are extrapyramidal? Vestibulospinal, reticulospinal, rubrospinal, tectospinal. They are all called extrapyramidal. So any lesion in the basal ganglia or all these extrapyramidal tracts will lead to rigidity, where there is a resistance throughout the motion. Spasticity में क्या होता? Clasp knife resistance is what you need to understand. So typically tone is a continuous, passive, partial contraction of muscles. Otherwise, the muscles resistance to passive stretch during resting state. REM sleep में tone will come down. Cerebellar dysfunction में hypotonia will be there. मेरा right cerebellum को कुछ हो गया तो will I get left hypotonia or right hypotonia? Come on, who is going to give me the correct answer? If my right cerebellum को कुछ हो गया तो left में आता या right में आता hypotonia? Who is going to give me the correct answer? Very good. Tirth Thakur is saying there is a premonition for him to become a topper. Excellent. Always remember, there is a very important thing. Cerebral cortex में bleed हो गया तो corticospinal tract get affected and contralateral paralysis will occur. That means right side affected means left side you get the hemiplegia. Whereas cerebellar dysfunction, if there is cerebellar dysfunction, the hypotonia that you get is ipsilateral, same side will be the hypotonia. That is a favorite question of the examiner. Esters of fat soluble vitamins, cholesterol esterase will be digesting them. Cholesterol esterase. Enterokinase is activator of trypsinogen. Broca and Wernicke are connected by arcuate fasciculars. What are the calcium binding proteins? Cal binding. Naam hi bol rahe na, cal binding. Calmodulin, troponin. Right down. Histamine is produced by enterochromaffin cell. Very biscuity question. ये बताओ डॉक्टर, इसका आंसर करेक्ट बोलो. I will send you $1 million on WhatsApp. Nigeria scam. Reward center in the brain. Which one? Punch the answer, doctor. Shweta ji, Nisha ji, Chirag ji, Sunil ji, सब लोग क्लीन बॉल. देखा ना, 11:30 को मुरली भरद्वाज के साथ. आई एम सेविंग यू 1 मार्क. भुवेश क्लीन बॉल, सुधांशु क्लीन बॉल. फाइनली बिजोय भूषाल गर्मा गर्म आंसर दिया. Bijay, where are you from? Which part of the country? What is your dream branch? Typically, you have a prefrontal cortex. What is the purpose of prefrontal cortex, doctor? Abstract reasoning. Abstract reasoning is all prefrontal cortex. I still remember there used to be one guy, Masseter, in our batch. Very brilliant guy. Physiology में उनको gold medal मिला. तो वो MBBS डेज में prefrontal cortex is important for abstract thinking बोले तो पूरा क्लास में कितने लोगों को prominent forehead है बोल के चेक करना शुरू किया. In his opinion, those who have forehead are brainy guys, all the remaining are dumb idiots. Too much dumb. So, prefrontal cortex. Now, there is a ventral tegmental area, which is the one which is important for the reward pathway of the brain. And whenever you do an answer correct, we say wonderful. Then that ventral tegmental area becomes stimulated. Wow, I am right. My answer is right. Right? Similarly, of course, you also will give a compliment, no? Sir, आप बहुत अच्छा पढ़ाया बोल के बोले तो हमारा ventral tegmental area भी खुश हो जाएगा before we go to sleep. Right? Now, that is the point. Glucose is absorbed from proximal convoluted tubule. और एक बार मैं बोल रहा हूँ ना, nephron physiology, highest number of questions. I have given you that PDF now. Every subject में 50 topics, descending order of priority में that you need to finish. Totally 953 topics का PDF दिया ना. If you have not received that PDF, please call right away. 9000-868-356 is our helpline number. 3 things they will do. They will include you into our WhatsApp study group. They will send you the PDF. Third, they give you 3-day pass to our onlinemmbbs.com video library. You have 1000 hours of video content, 3000 video lectures, 2 lakh PowerPoint slides, 30,000 MCQs discussed, grouped into 953 topics, AIMS, All India, PGI, JIPMER, DNB, FMG, question bank, everything is being reviewed. Right, doctor? You get all that by subscribing to onlinemmbbs.com video library. How long? Mittal is asking, sir, what is hippocampus? Beta Mittal, हमारे limbic system बोल के एक रहता. It is important for our emotions, memory, sexual libido, hunger, everything. One of the components of that is amygdala, hippocampus. Hippocampus is an area very close to thalamus, hypothalamus, hippocampus, amygdala. They are all diencephalonic structures, right? Is there any notes for your video? Definitely, doctor. Every video in the onlinemmbbs.com video library में, every lesson में एक video रहता. Video के नीचे same PowerPoint will be available over there. So you can also review the PPT. PPT itself is a notes, right? And you have 2 lakh slides like this. So right away give a call to 9000-868-356 and get yourself enrolled, doctor. Subscribe. And every day 2 hours across the year. Across the year. Every year around 500 hours of live interactive session like this we will broadcast. And every Sunday grand test and discussion, every Saturday subject test and discussion. So please do join and tell your juniors. They need not go anywhere. East or west. Murli Bharadwaj is the best companion, classmate, roommate, studymate, benchmate in your preparation until you get the seat, right? So the sperm remains in epididymis for 24 hours. Who is the swimming teacher for sperm? Epididymis. Epididymis सिखाता है. Swimming teacher, right? So sperm remains in epididymis for 24 hours is what you need to remember. 18 to 24 hours. Inverse stretch reflex, मैंने बोला ना, Golgi tendon organ, muscle spindle, type 1 fibers, type 2A fibers, 2B fibers. Without that, there is no question paper, right? Now, doctor, Mittal is asking, sir, what are the minimum marks to get low-cost college after NEET UG in Gujarat? Oh, doctor, I am a Saraswati Putra, not a Lakshmi Putra. So, I only impart your knowledge, but I'm not very sure how the private colleges business and game runs like, right? So, but still, be part of our WhatsApp group so that we will try to help you with that information after the exam is over. Now, inverse stretch reflex is Golgi tendon. So, doctor, what is Golgi tendon reflex? It is also called the inverse stretch reflex. It is an inhibitory effect on the muscle. Whenever your tendon informs you, if the muscle is building a lot of tension, it is getting stretched. Tension is building in the muscle. Immediately in the tendon, the Golgi tendon organ will inform spinal cord by इसको बहुत stretching हो रहा है, कुछ ना कुछ करो. Then immediately it will send inhibitory reflexes to the agonistic muscles, right? So that is called the Golgi tendon organ. So Golgi tendon reflex, inverse stretch reflex. Now doctor, there are mechanoreceptors which are there in the tendons which perceive the muscle tension. That increased tension will be informed to spinal cord. In turn, the spinal cord will make the muscle to go into relaxation by inhibiting the agonist and reciprocally activating the antagonist is what you should remember. So, कल के एग्जाम में एग्जामिनर पूछेगा what type of reflex is Golgi tendon? Polysynaptic ipsilateral segmental reflex. That is what you need to answer. The organelle having DNA, mitochondrial DNA. ये तो biscuit question है. Melas. What is melas? Melas. LA means lactic acidosis. S is stroke-like episodes. Myopathy. Right? So that is called mitochondrial disorder is what you need to basically remember. Now, glucogenic hormone, glucagon, thyroxine, glucocorticoid. Biscuit question. ये स्टिमुलेट हो गया तो आपका ब्लड ग्लूकोज बढ़ जाता. ठीक है? So, Golgi tendon organ, Arun is saying it is not polysynaptic, it is bisynaptic. Is it? Just recheck. Now, delivery of a stimulus above threshold lead to action potential. Of course, it is called Allerton law. Which part of our thalamus? Once more, doctor. Favorite MCQ for the examiner. Bulna nahi. Immediately go back to onlinemmbbs.com video library and take an opportunity to review thalamic nuclei. Right? Definitely पूछेगा examiner. So, do you want to make any guess on this question, doctor? Punch your answer. Yes. Yes. Thalamic nuclei. Masala question for offer. फटाफट बोलो. Rajashri is proposing A. Excellent, doctor. Very good. Rajshekar, good to know that it is bisynaptic. Okay, agreed? So, doctor, typically, ventro-anterior nucleus, they are the ones which control our motor system. So fundamentally there is a plan that is being done, motor plan in the brain. And आपका basal ganglia रहता ना, they will fine tune it. So typically there is a striato-lenticular nucleus. Now in the thalamus, your ventro-anterior, ventrolateral nucleus in the thalamus, they have good connection with all the surrounding basal ganglia and with this motor and association areas in the brain. So that is what you need to remember, right? Now doctor, so you are ultimately going to remember like this. You have the caudate putamen globus pallidus, subthalamic nucleus, substantia nigra, sub basal ganglia is a controller. Ventro-anterior, ventrolateral nuclei of the thalamus is another controller. Then prefrontal, premotor and supplemental, primary motor, somatosensory, they all have relationship with this basal ganglia, and the ventro-anterior and ventrolateral nuclei of thalamus is what you need to remember. Good question. Suresh Krishna is asking, which type of AML has the best prognosis? APML, acute promyelocytic leukemia. Why? If you happen to give ATRA, that is all trans retinoic acid, then the APML get cured. But with APML, what are the two complications you should remember? APML can lead to disseminated intravascular coagulation. Unless your blood bank is ready with fresh frozen plasma, if you admit a APML, he may go into endless bleeding. That's one challenge. If you start the ATRA, all trans retinoic acid, patient can develop sudden dyspnea. What is that called as? It is called as ATRA syndrome. The moment the APML cells are broken, it will release the antigens which will lead to significant alveolar edema. So that is the reason ATRA syndrome can occur after you start the ATRA. That's the point you need to remember, right? Now, yes, doctor. Yeah. Now, what is the active form of vitamin D3? It is calcitriol. Rajshekar Reddy is asking, sir, are you MD from KMC? I'm MBBS from KMC, Kakadiya Medical College, Warangal, and I did my MD from Nizam's Institute of Medical Sciences in Hyderabad. Right? Now, inhibin A is produced by, this is a beautiful question, doctor. कल के एग्जाम में आएगा sertoli cell. So typically in males, inhibin A is produced by sertoli cells. They are all in the seminiferous tubules. Androgens stimulate the inhibin production, and that is very important to regulate the spermatogenesis, that is in the case of the males. Inhibin A. Activin. Activin is produced in gonads, pituitary gland, placenta and other organs. Activin increases the FSH binding. It also participates in the androgen synthesis by enhancing the LH action in the ovary, is what you need to basically remember. Now, activin enhances spermatogenesis. That's what you should remember. Okay? So, now doctor, which hormone receptor has 4 subunits? Tyrosine kinase activity. What is your answer? Of course, हमारा इंसुलिन भैया को टायरोसिन किनेस एक्टिविटी है ना, you can't forget. Name this hormone which has an inhibitory effect on developing follicles, and it is also the one which has an inhibiting effect on the pituitary. So it is inhibin B. Inhibin B typically from the developing follicles has an effect, inhibitory effect on pituitary, is what you need to appreciate. Beautiful question, doctor, this is. Small stimulus causes large pain. What is that called as? Even small stimulus causes large pain. What is that called as? Question number 44. I know 2 confusing answers for this question. Yes. Punch your answer, doctor. Keyur Patel is saying hyperalgesia. Right? Keyur Patel is saying hyperalgesia. Manish is also saying. Muzzam Haider rightly says allodynia. Doctor, remember, allodynia, hyperalgesia देखने में similar लगता, but lower threshold, otherwise a small stimulus, produces the pain which is otherwise very innocuous, non-painful stimulus. That produces the pain, that is allodynia, that is increased sensitivity and lowering of threshold. Then hyperalgesia means if you give the equal noxious stimulus in two people, increased response को hyperalgesia बोलते हैं. That is what examiner is trying to trick you on. Hypersensitivity or increased pain stimuli that would normally not cause pain, that is called allodynia. Just like a light feather touch, if the patient says pain is there. A light breeze of wind also very severe pain, that is allodynia. What is correct about solute excretion in water diuresis? There are two kinds of diuresis, water diuresis, osmotic diuresis. दोनों में there is an increased urinary flow rate. But there is no change in excretion of solutes, that's called water diuresis. There is water and solute, both of them are lost. Examples. Whenever diabetes insipidus, ADH deficiency is there, then water diuresis. Whereas hyperglycemia leading to polyuria, that is osmotic diuresis. So that is the story. Is physiology easy or hard? Not at all hard. It is very, very easy. 1 minute, doctor, I'll get some water. आप भी किचन से कड़क कड़क चाय के लिए बोलो. So now, doctor, guys, Suhas is asking, sir, when two options are ruled out, we get stuck in choosing one. Most of the time, I choose wrong one. How to prevent this? Abba. It is like saying, Suhas, whenever my girlfriend and her roommate, both of them are proposing, I am stuck in choosing one. Most of the times I choose the wrong girl and go for date, which gets screwed up. How to prevent it? Is it the correct translation? So, doctor, if you prepared well, all these trivial doubts don't come. It is like a younger brother asking, भैया मैं साइकिल में जाते हुए अगर गिर जा रहा हूं तो लेफ्ट लेग पहला लगाना या राइट लेग पहला लगाना. I see a lot of pep talk videos how to solve MCQs and all that. I listen on I see on the YouTube. I feel funny. See, doctor, if your concepts are clear, there's no big deal in attacking. You don't even recognize or you don't even feel them. If you feel them too significantly, that means we are little early stage of preparation. That's the point, right? So don't worry. You'll overcome all that. Just to choose what your intuition, hunch says, jump and answer. That's all. There is sometimes it goes wrong, sometimes it goes right. That's all. Now, Menkes disease is due to deficiency of Menkes hair syndrome, copper. Hartnup disease will present with pellagra-like symptoms. What is Hartnup, doctor? Autosomal recessive deficiency of neutral amino acid transporters. where in the proximal renal tubules that lead to neutral amino aciduria, decreased absorption of the neutral amino acids in the gut, leading to decreased tryptophan, leading to development of pellagra, is called as Hartnup disease, is what you should remember. Now, doctor, what are derivatives of tryptophan? Melatonin, serotonin, niacin, not a creatinine. वो तो too much biscuit question है. Chaperones क्या करेगा? Misfolded proteins को correctly fold करेगा. Simple question, biscuit question. Now, doctor, which is an X-linked condition presenting with urolithiasis, gouty arthritis, self-mutilation, Lesch-Knihan syndrome due to HGPRT deficiency, hypoxanthine phosphoribosyl transferase deficiency is what you need to remember. भैया मैं अभी भी बोल रहा हूँ, कल भी बोलूंगा, परसों भी बोलूंगा, यूरिया साइकिल के बिना अगर नीट पीजी खाए तो मुझे पूछो, definitely होगा, right? So, sure short question. It occurs both in mitochondria, cytoplasm. Doctor, quickly tell me, urea cycle. N-acetyl glutamate, carbamyl phosphate synthase 1 is associated with urea cycle, 2 is associated with pyrimidine biosynthesis. You'll remember now? How will you remember? Urea cycle में carbamyl phosphate synthase 1. How will you remember? Urea cycle means urine means one finger means CPS1. Pyrimidines are 2, so CPS2. Ammonia plus bicarbonate forms carbamyl phosphate. Carbamyl phosphate enters into the cycle, combines with ornithine to form citrulline. Citrulline becomes arginosuccinate. Aspartate enters into the life of it. It's called arginosuccinate synthase. Arginosuccinate becomes arginine by the action of lyase. Arginine breaks into ornithine by the arginase 1 is what you need to remember. Right, doctor? So, some of them happen in the liver, some of them happen in the kidney. You need to be very sure on where are the enzymes located. Now, prostaglandins are derived from arachidonic acid, right? What is the initiator codon in prokaryotes? Punch this genetic answer, doctor. Genetic level में आपको नीट पीजी में जेनेटिक लेवल रेसिस्टेंस आ गया या नहीं आया देखेंगे. Yes. Give me an answer, doctor. Everyone is saying AUG. Correct. Beautiful, doctor. Initiating AUG codon is recognized by initiator tRNA. Once more, doctor. RNA protein synthesis ka every step P site, A site, all sites you should be good. So the recognition is facilitated by IF2 bound to GTP in prokaryotes or elongation factor 2 GTP in case of eukaryotes. So this amino acid which is charged on this initiated tRNA enters into the ribosomal P site and GTP is hydrolyzed into GDP. That is what you need to remember. So mainly remember elongation factor 2 GTP is involved. AUG is the initiator codon. It is going to bind with ribosomal P site. That is the whole funda. Uva, uvag, uga are terminator codons. Uva, uag, uga, right? हाँ, जरा अफ्रीकन लैंग्वेज भी आना है MD में सीट के लिए, right? Now, doctor, mental retardation is a feature of phenylketonuria. What is the precursor of melanin, doctor? Tyrosine. G6PD, where is it located? Cell membrane. Inheritance pattern of G6PD होता है X-linked. Once more, कल के एग्जाम में one question, कल का नहीं, कब का? कल का. Another 10 minutes is there. Inheritance pattern, doctor. Autosomal recessive, autosomal dominant, X-linked recessive, X-linked dominant, pedigrees, mitochondrial. Every time mother only giving, mother only giving, mother only giving kind of a pedigree hai to, you'll remember mitochondrial inheritance. Right, doctor? Now, what is the correct order of polymerase chain reaction? Denaturing stage, annealing stage, extending stage. Temperature, denaturing में 94 to 95, annealing में 50 to 56, extending में 72 degrees Celsius is what you need to remember. Collagen contains the amino acids proline, lysine, and what else? Up foreign medical graduate exam का December 2019, June 2019, 2018 June भी देखा. Every time same question. Collagen, glycine. Be very sure. Disulfide bonds. Which is the sulfur containing amino acid? Cysteine. What is the activator of trypsinogen? Enteropeptidase. इसका आंसर बोलो मियाँ. आपको 1 करोड़ रुपए दे देंगे. WhatsApp, Nigerian scam. Physiological uncoupler. Which one is physiological uncoupler? Come on, punch your answer. Physiological uncoupler. Mousin Khan, you are giving the most famous wrong answer. Doctor, massively mistake मत करो. मैं रोता हूँ, मैं रोऊंगा, मैं रो रहा हूँ. अरे बाप, संतोष भी रॉन्ग बोल दिया. Come on doctor, tomorrow NEETPG में mistakes करो मगर ऐसे mistakes नको करो. Very good. I am proud of all you guys answering D. Unconjugated bilirubin. Natural, physiological. So doctor, bilirubin, thyroxine, long chain free fatty acids. Uncouplers are 2,3-dinitrothenol is uncoupler. Tension नहीं है, मान लेते, मगर physiological uncoupler. Unconjugated bilirubin, thyroxine, aspirin, long chain fatty acids. Aspirin भी है क्या? अब्बा, aspirin भी है. Right? So unconjugated bilirubin, thyroxine, aspirin, long chain fatty acids, large doses में. You need to remember as physiological uncoupler. Now, doctor, Sudhanshu said, I said D. Very good, Sudhanshu. Only हमारा नन्हे मुन्ने प्यारे Sudhanshu ही correct बोला. Right? हाँ. Which is not seen in DNA. ये तो biscuit question. Uracil. Principal building block in fatty acid synthesis. Acetyl-CoA become malonyl-CoA. What is that enzyme called? Acetyl-CoA carboxylase is that enzyme. Acetyl-CoA carboxylase. That is the principal building, rate limiting factor. Motion sickness के लिए दवा बताओ राजू. Who is the biggest competition after you go into practice? Medical shop fellows only will start disposing the medicines even without you prescribing. Right, doctor? So don't think you are the first MD becoming. There's a bigger competition in the market. Promethazine is what you need to remember. Motion sickness may you give hyoscine, scopolamine, diphenhydramine, cyclizine, meclizine, promethazine, cinnarizine. Morning sickness for the hyperemesis gravidarum, what will you give? Doxylamine, dicyclomine, meclizine, pyridoxine, 20 to 60 mg per day. You should not forget. 201. Kush Hua Mogambo. Thank you very much for participating in this wonderful discussion, doctor. Midnight 12 baje ko bhi. That means you are very sure Dr. Murali Bharadwaj discusses definitely high yield points. Sure, doctor. Right? You are my life, you are my mission. हमको कुछ भी नहीं आता इतना अच्छा करने का. What is passionate? Enjoyably we will do that. So that's the reason. Tell your juniors not to look anywhere, only to look for Dr. Murali Bharadwaj as the roommate, benchmate, classmate, reading roommate to accompany you across the year, every day spending a couple of hours with the friends across. So ask them to subscribe to onlinembbs.com. We even have video lectures for passing MBBS theory. Video lectures are also there. First year, second year, third year, final year. For passing MBBS exams also, we have got the video lectures in the onlinembbs.com. They can all join. Right, doctor? Now, exenatide, dekho. FMG, December, June, 2019, 2018, every year, exenatide छोड़ेगा नहीं एग्जामिनर क्योंकि परमपिता परमात्मा के सर्वर में बैठा हुआ है. So what is your answer, doctor? Punch your answer. DP, GLP-1 analog. So you have GLP-1 analogs. कल भी मैंने आपको यही बात बताया, एक्सेनाटाइड, लिराग्लुटाइड. You have DPP-4 inhibitors, sitagliptin, saxagliptin, linagliptin, they're all DPP-4. So whenever you eat food, small intestine will secrete GLP-1. GLP-1 will go to pancreas. Tell भैया pancreas insulin बनाओ क्योंकि ये खा रहा है लड्डू. But GLP-1 is inhibited by this DPP-4. So you have two options, easy way, difficult way. DPP-4 को inhibit कर सकते हैं, नहीं तो GLP-1 का analog दे सकते हैं. So आपका exenatide, liraglutide, GLP-1 analog, whereas sitagliptin, saxagliptin, linagliptin, they're all DPP-4 inhibitors. So कल के एग्जाम में what is the deal? Secret deal. Don't tell anybody. Right? What is the secret question leak? Definitely without a question on types of insulin and oral hypoglycemic agents. अगर examiner conduct करे तो exam मेरा नाम मुरली भरद्वाज नहीं. ठीक है? Now doctor, Enterococcus fecalis, ampicillin is administered. Enterococcus faecium, fecalis. They are responsible for the prosthetic and native valve enterococcal endocarditis. How does the enterococcal endocarditis differ from any other endocarditis? Only giving penicillin is not enough in enterococcal endocarditis. You have to give aminoglycoside plus penicillin. Right? So, Enterococcus faecium, we give linezolid, quinaprestin, delaprestin. Then Enterococcus fecalis, we give imipenem, silastin plus ampicillin. Ceftriaxone plus ampicillin. That's how you basically administer and treat for 8 weeks. That's the point. अब्बा, दिस इज ए पेनफुल क्वेश्चन. पहला ओजिल्टामिविर तमीफ्लू मालूम होना ही दिक्कत है. ऊपर से 3 to 5 months बेबीज में प्रोफिलैक्सिस के लिए, स्वाइन फ्लू के लिए डोज पूछ रहे हैं. हमको मलेरियल ड्रग का डोज ही मालूम नहीं, राइट? तो जाके ओजिल्टामिविर पूछते क्या? बट रिमेंबर डॉक्टर, ऐसा क्वेश्चन आए तो छोड़ देना, जंप, डोंट वेस्ट इवन टाइम, डोंट वेस्ट इवन टाइम, बिकॉज यू डोंट नो. स्टिल इफ यू स्टार्ट सिटिंग इन एग्जाम, 3 हो सकता या 5 हो सकता. ओ माय गॉड, आई थिंक मेरा दादाजी ने आसमान से बोल रहे हैं 10 बेटा, 10 आंसर करो बेटा. वैसा नहीं करना, क्योंकि नेगेटिव मार्क के एग्जाम में यू हैव टू बी केयरफुल डॉक्टर, राइट? हाँ. Now it is, anyway, since we touch based 3 mg per kg per day, twice day, right? So for the prophylaxis of meningococcal meningitis in pregnancy, what will you give, doctor? We give ceftriaxone, 3rd generation cephalosporin. What is the most potent analgesic, doctor? Sufentanil. कल भी एक क्वेश्चन पूछा एग्जामिनर ने, ओपियोइड एनाल्जेसिक्स क्लासिफिकेशन, व्हिच इज फास्ट एक्टिंग, स्लो एक्टिंग, blah 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 blah. You should be ready. Sufentanil. This is a beautiful question, doctor. One question on antibiotic mechanism of action. 30S, 50S, everything you should be ready. So what is your answer? Streptomycin is a bacterial protein synthesis inhibitor. Buy at 30, sell at 50. 30 का 50, 30 का 50. Do we have a internet issue, doctor? 1 minute. One minute, doctor. Yeah, sorry for a short interruption. Now am I clear? Clear for all of you? Very good. Buy at 30, sell at 50. भूलना नहीं कल के एग्जाम में. Okay? So, at means aminoglycoside tetracycline. They act on 30S ribosome को inhibit करेगा. 50, sell at 50. 50 बोले तो सेल क्लोराम्फेनिकोल, एरिथ्रोमाइसिन, लाइनसोलिड, क्लिंडामाइसिन, they are all 50S inhibitors. कल के एग्जाम में एग्जामिनर पूछेगा, डेफिनेटली पूछेगा, one of this 30S 50S you'll remember me. In pregnant female, which drug is strictly contraindicated? Streptomycin. What is the mechanism of action of alpha methyl dopa, doctor? Alpha 2 agonist. Alpha 2 होता है प्रीसिनेप्टिक और पोस्टसिनेप्टिक. बोलो बोलो. अल्फा 2 होता है प्रीसिनेप्टिक, अल्फा 1 होता है पोस्ट सिनेप्टिक. अल्फा 2 कहां होता है? ब्रेन में होता है. So if this alpha 1 is stimulated, it will inhibit the sympathetic outflow. That is the reason alpha 1 agonists are all considered to be alpha 2 agonists are all considered to be antihypertensives, which is the mechanism of alpha methyl dopa, which is very safe in pregnancy. A female patient is being treated for chlamydia-induced UTI. Suddenly develops itching, pruritus, vaginal discharge, burning, micturition. Which drug you want to give, doctor? Azithromycin, wonderful for chlamydia. Pilocarpine is a meiotic. All of you know very well. Pilocarpine is a tertiary amine lipophilic. It is well absorbed. It is cholinomimetic. It has good distribution. It can go to BBB. It can cross the blood-brain barrier. It has a long duration of action. It is a muscarinic agonist. It acts on the eye to lead to the pupillary constriction. Fatafat revision karna. Now, doctor, recurrent fall in an elderly patient with postural hypotension. Which drug can be responsible? You should know prazosin. Prazosin can lead to postural hypotension, make an elderly man to fall down recurrently. Pilo is not given in uveitis. Ajay Maurya Badia. Now, most sensitive test for OP poisoning, obviously, acetylcholine esterase ka levels they glow. Coumarin necrosis is due to. Beautiful question. If you give warfarin, doctor, if you give warfarin, first 2 to 3 days of warfarin therapy, you have to give heparin. If you don't combine heparin, only give warfarin, at least first 2 to 3 days you have to combine heparin. If you don't combine, only give warfarin, patients will develop clots. Actually, warfarin is anticoagulant, but they develop procoagulant tendency. They develop small clots in the vessels which are supplying the skin that lead to skin necrosis. This is typically called warfarin associated skin necrosis because of thrombotic tendency. Abhi question पूछो सर जी वारफरिन होता है एंटीकोएगुलेंट ना, अगर वो दिए तो ए क्लॉट क्यों फॉर्म हो रहा है? There is a reason. First of all, how does warfarin act, doctor? Warfarin is a anti-vitamin K. Vitamin K. Agreed? Now, what are vitamin K dependent factors? Vitamin K dependent factors. 2, 7, 9, 10. They are all what? Procoagulants, clotting factors. इसको stop करने से क्या होता है? You will develop anticoagulant effect, which is the reason we give warfarin. But very good. Amreen Unnisa, मुंह की बात छीन लिया. There are 2 more vitamin K dependent factors. One is protein C, other is protein S. Naturally, they are anticoagulant. Anticoagulant. So, if you give warfarin, which is anti-vitamin K, you are giving anti-protein CS, you are anticoagulant. That means this lead to a fall of protein C, protein S lead to coagulant tendency. Unfortunately, when you give warfarin, it will lead to fall of vitamin K dependent factors. So it will cause the fall of clotting factors 2, 7, 9, 10. It also causes the fall of protein C, protein S, which are anticoagulant. And these anticoagulant factors have a shorter half-life. So first to fall will be the anticoagulant factors leading to procoagulant tendency. That is the reason, मेरे प्यारे भारतवासियों, जब आप Coumarin derivatives warfarin दिए तो पहला 2 to 3 days give heparin, add heparin. That is very, very important. Now, factor 10A inhibitor. Once more, doctor, I am telling you, कल के एग्जाम में Sure shot आएगा. Antiplatelets, antiplatelet agents, anticoagulants, thrombolytics and fibrinolytics. Without that, there is no NEETPG. I hope you're all ready with that. But anyway, quickly let me tell you, what is your answer for this? Factor 10A inhibitor? Pramod rightly is telling Apixaban. You remember one of the evening, 2 घंटे हम खेलते revision किए थे. One of the days, evening, चाय पे चर्चा with Dr. Murali Bharadwaj. So those who are new to this session, please call 9000868356. Our helpline, phone number. They will give you the PDF of 953 high yield topics list. Number 2, they will include you in our WhatsApp study group where we have 20,000 students. They will give you 3-day free pass to onlinembbs.com video library. Additionally, you will also get an intimation every day whenever we are starting the live HD broadcast on YouTube every day. So across the year we will be with you for your preparation. It's not just we throw some set of videos in a mobile app and ask you go through them. Mobile apps, videos, only videos are like books. Right? In fact, it's more easier to read a book. What is required is interaction, flipped classroom. You prepare and come beforehand, we will tell you the topics and join an interactive session. Get stimulated every day to prepare. That is the whole buzzword in the modern internet era. Teacher and student can sit anywhere in the world. Now, doctor, be very sure about this list, doctor. Very sure about this list. Factor 2A inhibitors. Factor 2A inhibitors. Ximelgatran, dabigatran, पूरा gatrans होता है. Oral 2A inhibitors. Factor 2 बोले तो क्या है? Thrombin, right? Now, rivaroxaban, apixaban, edoxaban, they're all oral 10A inhibitors. You'll remember, right? Ximelgatran, gatran में T होता, T is thrombus, thrombin, factor 2. Dabigatran, gatran में होता है T, T is factor 2. Rivaroxaban में होता है X. Apixaban also you have X. So remember it is a factor 10A inhibitor which acts like a anticoagulant. So broadly, what are antiplatelets? COX inhibitors, aspirin, NSAIDs. GP2B3A inhibitors. Eptifibatide, tirofiban, apixaban, they're all GP2B3A inhibitors. Then you have P2Y12 inhibitors. Clopidogrel, prasugrel, ticagrel, ticlopidine. Then you have phosphodiesterase inhibitors. Silostazole and dipyridamole. Then what are anticoagulants? Direct thrombin inhibitors को बोलना नहीं. Argatroban, bivalurudin, dabigatran, hirudin, desirudin, they're all called directly. तो जाके factor 2 को खत्म करेगा. What are indirect thrombin inhibitors? Dalteparin, enoxaparin, fondaparinux, they're all indirect thrombin inhibitor. That means वो जाके एंटी थ्रोम्बिन को स्टिमुलेट करेगा. वो बोलेगा भैया एंटी थ्रोम्बिन जाके थ्रोम्बिन को खत्म करो बोले तो वो जाके खत्म करेगा उसको. Then direct 10A inhibitors, apixaban, all XXX. Then you have vitamin K antagonists like warfarin. Then what are thrombolytics? Plasminogen activators. Plasminogen become plasmin. Plasmin will be antithrombotic, breaks the thrombus. So streptokinase, tenecteplase, retiplase, etc., etc. That is what you need to remember. Which is a opioid receptor, doctor? Delta. Mu, kappa, delta, sigma. All your meiosis, euphoria, physical dependence, constipation, they're all mu. What is the universal side effect of the opioids? Constipation is called universal side effect. Right, doc? Good night, cricket guru. Neha, good night. And if you are feeling sleepy, sleep, doctor. No worries, no worries. This video रहेगा. Exam को जाने के पहले एक बार देख सकते हैं. Now, CYD TDV. CYD TDV. Come on. Shoot your answer, doctor. Who is going to be the correct answer for this question? CYD TDV vaccine is for which infection? Which infection is making everybody become rich nowadays? एक IV लाइन लगाओ, 10,000 ले लो पेशेंट से. Very good. आशीष पांडे, आशीष पांडे, केयूर पटेल. Dengue. CYD TDV is a live recombinant tetravalent dengue vaccine, 3-dose series, 0-6-12 month schedule, which is under phase 3 trials. Paracetamol. Neha, final tips please. Drink water, take a soft pillow and sleep. That is the only tip. Don't carry brain, only carry cauda equina, spinal cord to exam hall. Then you will become topper, Neha. Right? God bless you. Good luck. Now, Shweta, good night. So, paracetamol causes hepatotoxicity, all of you know. 2-year-old child, refractive error test. Children may, accommodation is very strong. So, you give atropine ointment is what you need to remember. People are saying good night and once more the number of viewers is increasing. ये कैसे हो रहे हैं? While going to sleep, don't put on YouTube. Now, indomethacin अगर दिए तो क्या होता? Indomethacin. Prostaglandins make the PDA remain patent. Indomethacin closes the PDA. That's what you need to remember. Laxative used in hepatic encephalopathy. Lactulose. A violent maniac. Don't give him cognitive therapy. If he is violent maniac, कॉग्निटिव थेरेपी देने का शुरू करे तो वो तेरा गला घोंट देगा और तुझे मार के चले जाएगा. न्यूट्रोपीनिया आफ्टर कीमोथेरेपी, हाउ डू यू वांट टू ट्रीट? अरे कल तो आप जंग खेलना है, हम तो ऑब्स्टेट्रिशियन हैं. यू आर द वन हु नीड टू बेयर द लेबर पेन्स एंड डिलीवर द बेबी, राइट डॉक्टर? हैव ए गुड रेस्ट श्वेता. Now, neutropenia after chemotherapy, filgrastim. Leishmaniasis, visceral leishmaniasis. What is the drug of choice, doctor? Liposomal amphotericin B is visceral leishmaniasis. Why do you add zinc with insulin? Why do you add zinc with insulin? That will provide stability to the insulin molecule. Once more, doctor. What is called peakless insulin? कल के एग्जाम में पूछेगा. Glorgin is what you should answer. Half-life of parathormone. One more numerical. I can't believe we reached 220 online. Oh my God. Okay. Are you sure? You are not sleeping? If you are sleeping, we will call it off. Otherwise, I have another 60 questions to discuss. Depends on you. Come on, punch the answer, doctor. Punch, punch, punch. 4 मिनट का मेला है, छोटा है ये जिंदगी. Okay, 4 minutes. Once more I told you now, one question on phases of clinical trials. Question आएगा. Good practice is not needed for preclinical animal studies के ऊपर, but others you require. Anal cancer. What is a very good treatment for anal cancer? Always chemo. Chemo, excellent for anal cancer. We use 5-fluorouracil to treat the anal cancer. 5-fluorouracil combined with mitomycin C or cisplatin is what you need to remember. What is the drug of choice for UTI? Phosphomycin. Phosphomycin, single 3-gram dosage. That's the beauty part of it. Single 3-gram dose to treat uncomplicated urinary tract infections is what you need to remember. So that is part 1. Negro regime, correct. Sudhanshu rightly says. 2 minutes, doctor. I have to download the PowerPoint of the remaining 60 questions, which I plan to finish before we go to sleep. 2 minutes, be online. By chance, if I go offline, I will restart the broadcast. Please, 1 minute. Now, doctor, continuing our journey. Now, hypoxia, sensitive order of fibers. Definitely आने वाला question है कल के लिए. Sharad is saying, sir, let us do night out. हम तो ready है, एक कड़क चाय मिल गया तो चलते रहेगा. Voice box. Diabetic nephropathy, Kimmel-Stein-Wilson's. Stellate granuloma. Where do you see, doctor? AD is asking, sir, how many expected questions for tomorrow? Expected questions, मालूम नहीं. All expected topics. I am guaranteeing you. Apoptosis, inheritance pattern, right? Scravo, CR, Vivo, glaucoma drugs. Examiner, what else he has? He has no other choice. Out of 300 questions, at most 15-20 questions, jara outlier de sakta. Remaining questions he has to give. He had been giving past 25 years से देख रहे हम, right? यही होता है. हाँ, कड़क चाय after 7 p.m. tomorrow. Every day evening 6 to 8 p.m. doctor. We have a live online class. If there is any delay, we will update you in the WhatsApp study group. So that is for sure, right? Huh. So stellate granuloma is found in cat scratch disease. Necrotizing granulomatous lymphadenitis caused by Bottonella Hensley is cat scratch disease. इसमें क्या होता है? stellate granuloma is what you need to remember. देखो भैया, ये FMG दिसंबर 2018 में भी पूछा और 2019 जनवरी में लास्ट ईयर जो हमारा NEETPG हुआ वहां भी आया. So that is the reason favorite question of the examiner, right? So Raju is saying, sir, we love your attitude. Definitely, doctor, definitely. Attitude like catitude. You should only, actually, 1999 May, I prepared for MD entrance. I was preparing for entrance. 2 minutes, I'll give you one small, a short story. So, during the days when I was preparing for entrance exam, I myself did not have the seat, but I told, I'm going, Dr. Murali Bharadwaj is going, already I wrote about 18 books in MBBS only, MCQ reviews. So I told, I'm starting coaching means 250 students, Usmania, Gandhi, Deccan Medical College, they all came and they used to sit. Half of them never paid fee. Half what? Almost 80% they don't pay fee. Remaining people, they pay fee if the landlord comes and threatens me to pay the rent. I used to collect 100 rupees diya, le lo. 1000 rupees diya, le lo. Right? So, what I was trying to tell you is, so tomorrow is the entrance means today. I still remember sitting with all of them. Satyavati, Rekha, Madhavi, Sunil, NVN Reddy, they're all very, very top guys. I was sitting and doing revision with them. Then when the results came, first 100 में 86 ranks आया. All our zombies who were with me. Remaining 250 में almost except 40-50 people remaining all got the seat. Right? In that attempt, you know what my rank was? My rank was only 208. But my students were second, third, sixth, fourth. Dr. Shabana is our student from Deccan Medical College. She got second rank. Deccan Medical College ka history mein, she was the highest ranker in those days. So I was getting DCH. My students were getting excellent seats. Some students were crying, sir, aap gaye to hamara kya ho jata bolke. I still remember Pranita was, sir, if you join DCH, you are not born for that, sir, you are born for teaching, bola. I said, okay. I did not take the seat. I came back. I once more started the coaching program. Remaining students all joined. But when I restarted coaching, NVN Reddy and few people, they are all toppers. They came and sat in the class, early morning class. मैंने बोला अरे क्या है रे तुम लोगों को 4th rank 8th rank सब में आया ना. They said no, we are preparing for PGI AIMS, we don't want to join, come on continue teaching बोला. So that year, in the next 2-3 months later, I myself got the state top rank and in the Nizam Institute of Medical Sciences entrance, which is like AIMS in Andhra Pradesh. So, and our students got in PGI and AIMS. So what I'm trying to tell you is, in those days I used to sit like this before day exam also. But luckily today, because there is a internet, you are all across the country, I have a chance to sit with you all guys and spend time. I am very sure, doctor, a good number of you are going to be in the top 100. I'm not worried about top 100. You should get a decent seat of your choice. That is the most important thing, right? So, honestly speaking, my experience always, doctor, top 100 rankers go, they don't need any help. They are highly self-motivated guys. Without any help only they will make it. But there are people who are in the borderline, to whom I am an everyday classmate. I promise to be their everyday classmate, to make them to get the dream seat and to stand in the first 1000 ranks. Right? So, xenograft is graft across the species is what you need to remember. Thank you, Sudhanshu. Please don't forget to send Laddu in WhatsApp when you get the seat. And also come back and start teaching freely on this floor and continue this legacy. So, doctor, between different species, So, what is meant by one of the important questions is different definitions. Identical twins के बीच में isograft, within an individual auto, non-identical allo, between chimpanzee and us, it is xeno. So, doctor, which proteoglycan is involved in the process of healing? Syndecan is a proteoglycan. Recently, yesterday when we discussed, glycosaminoglycans is a favorite thing in the examiner's question bank, even proteoglycan, right? So, anaplasia, metaplasia, hyperplasia, एक क्वेश्चन पूछेगा. Anaplasia होता है de-differentiation, it is pre-malignant condition. और एक चीज डॉक्टर, मायोकार्डियल इंफार्क्शन का हिस्टोलॉजी टाइम टेबल रहता ना, डेफिनेटली आने वाला क्वेश्चन है. So you should remember, hypereosinophilia of myocytes is what you see within 12 hours. First 4 hours, no gross features. 4 to 12 hours, dark mottling, coagulation necrosis. 12 to 24 hours, pycnosis, hypereosinophilia. This is what examiner is asking. Marginal contraction band. Then 1 to 3 days, yellow tan infarct. Right? And neutrophilic infiltration. 3 to 7 days, hyperemic border. Histology of MI. Pathology में top 20 topics में रहता है. Okay? Now doctor, cell that can form any other cell in the body, totipotent. X-linked recessive inheritance कहाँ होता है? G6PD. Doctor, one pedigree will come in the today's exam, tomorrow day, today, right? So be very sure. Consanguinity, mama के daddy, sisters, daughter के ऊपर you are eyeing her. Consanguinity is what you see in autosomal recessive. Horizontal transmission. The king of the England passes the genes to the king of the Poland. Queen Victoria is called the grandmother of Europe. Unka one grandson is the king of Poland, another grandson is for Prussia, one is for Germany, like that. So, consanguinity, autosomal recessive. Horizontal transmission. Then parents do not show anything. Unaffected carrier parents. So earlier generation में कहीं भी खानदान में कभी भी नहीं है बोल के सुनाई देता. Not in earlier generation. On average 25% recurrence risk. Males and females are affected. Then what are X-linked dominant? X-linked recessive मालूम है, dominant भी है. Very important, this list. Males and females are affected. Generally X-linked means only males, not females, but X-linked dominant है तो males and females are also affected. But it is lethal in males. Right? Vitamin D resistant rickets, don't forget, there are only 4 conditions X-linked dominant. Fragile X syndrome, incontinentia pigmenti, Rett syndrome. They're all X-linked dominant is what you need to remember. Then autosomal dominant, typically you find variable penetrance, variable expressivity. रामू को भी हेरिडिटरी सेरोसाइटोसिस है, उनका भैया भीमू को भी है. भीमू का उतना सीवियर नहीं है, रामू को ही सीवियर है. Got it? That's called variable expressivity. Then in a population, out of 140 have the gene, but only 10 have phenotypic expression. That's called variable penetrance. Variable expressivity, variable penetrance is the nature of autosomal dominant. Then vertical transmission is a classical feature of autosomal dominant. देन एक्सलेंट रेसिड्यू का पूरा लिस्ट रहना है मन के अंदर. Hemophilia A and B, Duchenne's muscular dystrophy, anhidrotic ectodermal metaplasia, dysplasia, color blindness, Hunter syndrome. Hunter. किसको हंट करते? Boys hunt for girls. So X-linked होता है hunter. हंट करने के लिए कॉर्निया दिखाई देना, corneal clarity is hunter. Corneal clouding in Hurler, don't forget. G6PD deficiency, Lesch-Cunningham, Menke, Fabry is F for Fabry, F for female, female for X, X-linked is Fabry, is what you need to remember. Kittu Mino, I love you Kittu. So, sir, I am depressed that I didn't get PG seat in the last 2 attempts. Your lectures are motivational and brought hope for me this time. I am telling you now, Kittu, you will get what you want. What is your favorite branch, Kittu? Fatafat bolo. Right now, I will do a telephone call to the God and ask you to give the favorite branch of Kittu. Fatafat bolo. हाँ. पिनाकी चक्रवर्ती राजकीय, सर आपका डेली क्लास होता है क्या? आई एम द फर्स्ट टाइमर. डेली होता है. हमको इनबॉर्न एरर ऑफ मेटाबॉलिज्म है पढ़ाने का. सो रोज आपके साथ पढ़ाई करें तो इट इज लाइक टेकिंग ए ब्लड ट्रांसफ्यूजन फॉर मी. सो दैट इज द रीजन एवरी डे होता है. सो पिनाकी, प्लीज कॉल 90000868 लिख लो हेल्पलाइन नंबर. 3 things will happen. You will be included into our WhatsApp study group. Then you will get a PDF of the 953 topics that you need to prepare. Also, every time I am starting the class, you will get a WhatsApp alert, and you get a 3-day free pass into onlinemmbbs.com video library. Okay? So right away, WhatsApp or call 90000868 Neha, don't regret. Regret, guilt was कभी भी नहीं होना. Better late than never, whether it is romance or whether it is war, right? So consanguinity is seen in, देखो, examiner favorite question, autosomal recessive. कल के एग्जाम में जरूर पूछेगा इनहेरिटेंस पैटर्न के ऊपर. गुड पास्चर सिंड्रोम इज इन किडनी ग्लोमेरुलर बेसमेंट मेम्ब्रेन, राइट? नाउ सेकेंडरी हीलिंग, हाउ डज इट occur? Healing by primary intention means the both wound ends are very close, healing हो जाता. Healing with granulation is called secondary healing, is what you need to remember. Now, in bronchial asthma, there is a increase in goblet cells, hypertrophy of smooth muscle, increased IgE. They are all 2 statements. Type 2 hypersensitivity reaction. What is type 2? Antibodies are free floating. Antigen is fixed on the cell membrane. What is type 3? Antigen antibody form immune complex, and that goes and deposits everywhere. So where do you have free moving fixed antigen with a free floating antibody in case of autoimmune hemolytic reaction? RBC membrane के ऊपर fixed antigen है, antibodies against RBC are free floating, so type 2 hypersensitivity reaction. Acute graft rejection का मतलब है शादी हुआ within days to weeks only, talak. What is hyperacute? Hyperacute occur because of preformed antibodies. Engagement हुआ, dating शुरू हुआ, तलाक, even शादी के पहले ही, within minutes, while the surgeon is scrubbing his hands after surgery, already kidney gone. So iron deficiency anemia में, this is the favorite question. Amrain Unisa, good night, Shubhratri. Right? So, thank you for joining and spending time with all of us. Good luck for the tomorrow's exam. Iron deficiency anemia. TIBC become elevated, doctor. Hemoglobin falls, ferritin falls, percentage saturation falls. So once more, कल के एग्जाम में पूछेगा iron deficiency versus anemia of chronic disease versus sideroblastic versus thalassemia. Iron deficiency, anemia of chronic disease में iron will fall, sideroblastic it will increase. TIBC will increase only in iron deficiency. Percentage saturation will fall in both iron and chronic disease, but sideroblastic it will increase. Ferritin will fall. One of the early thing to fall in iron deficiency is ferritin is what you need to remember. Now, Dr. Shoman, no regrets. You are going to be topper. At least we met. At least we met. That's more than enough, right? Enjoy a good sleep and go to exam. Attack the examiner. हमला करना, दंगल मूवी में होता ना बेटा, हमला हमला, डिफेंस नहीं ऑफेंस खेलो, राइट? सो यू ऑल बिलोंग टू डॉक्टर मुरली भरद्वाज सुपर 2000 बैच, टॉप 2000 रैंक्स में आके मुझे व्हाट्सएप में लड्डू भिजाओ. आयरन डेफिशिएंसी में आयरन विल फॉल, राइट? Hemochromatosis में iron will elevate. Anemia of chronic disease, iron will fall. Hemolytic anemia, iron will rise. Sideroblastic anemia, it will rise. Iron poisoning, it will rise. Whereas TIBC rises only in iron deficiency. That is the point you need to catch it. Now, doctor, MEN2A syndrome. Parathyroid, pituitary, pancreas, gastrinoma, zoningerellism, all three centrally located structures. Pheochromocytoma, it produces norepinephrine, VIP, calcitonin, they're all produced in pheo, right? Now, fungal infection is there, brown colored spherical fungi. Brown colored spherical fungi, septate hyphae. Batao, doctor, what is your answer? Let me check how many will answer correctly. I know all possible wrong answers. So one question on dimorphic fungi will be there tomorrow. Trisha Chakrabarti is saying blastomycosis, blast like answer. Absolutely right. Chromoblastomycosis. So what are these, doctor? Brown colored spherical fungi. Image based question आएगा कल, right? So blastomycosis are budding yeast cells, large spherical, thick, double contoured, single broad based bud. Broad based bud. B होता है B. Blastomycosis. So this is a typical lesion of blastomycosis, chromoblastomycosis. This is a double-walled spherical organism. And in some people, this kind of significant lesion can be there, chromoblastomycosis. Bacillus anthrax. What is it, doctor? It is a gram-positive rod. Once more, novobias insensitivity, right? Vaux-Proskayer's reaction, and mannitol fermenter, non-fermenter, lactose fermenter, non-fermenter, left, right. One question on gram-positive, gram-negative, identification test के ऊपर question आएगा कल, right? So, gram-positive rod with a square end होता है bacillus. There are large gram-positive rods, square ends arranged in long chains. Okay? Now, doctor, rapid diagnosis of rabies. How do you make it? Fluorescent antibody testing any day is the rapid diagnosis. DNA transfer using the phage is called transduction. Sporulation occurs in which time of spores are formed in which part of the bacterial growth curve. Absolutely, Sudhanshu rightly says bamboo, plectomedium, plectomedium. Stationary phase. There is a log phase, division of constant rate. Lag phase, typically there is a retooling for division. Then there is a stationary phase where nutrient pools are exhausted, cell growth will stop, they go into hibernation, sporulation occur, that is stationary phase. Granuloma with a positive AFB, biscuit question, leprosy. देखिए ना एग्जामिनर कितना बिस्किट्स देता है 300 मार्क्स में 300 MCQs में एटलीस्ट 50-60 बिस्किट्स मिलेगा आपको, नहीं तो हाइपोग्लाइसीमिया आएगा एग्जाम हॉल में, इसलिए बिस्किट देता है. सो डोंट वंडर सडनली इतना सिंपल क्वेश्चन पूछा क्या बोल के फीलिंग आए तो. Now, most common infectious disease leading to hemolysis, hemolytic uremic syndrome, is because of 1 E. coli O157 strain. Neisseria meningitis, terminal complement component pathway deficiency, C5 to C9. डॉक्टर कल के एग्जाम में भी, आज के एग्जाम में भी क्लासिकल अल्टरनेटिव complement pathway, which are anaphylatoxins, chemotactic factors, everything should be ready. That's a deal, right? So, antigen antibody complex will start classical complement pathway. The microbe which has antigens binds with antibodies, that antigen antibody complex will come and talk to C1. C1 will break C2 into C2A, C2B. Then it will also break C4 into C4A, C4B. C2A plus C4B combine to form C3. C3 will break into C3A, C3B. C3A is anaphylatoxin. C3A anaphylatoxin. C3A anaphylatoxin. Degranulation of mast cells. C3B, opsonization. That is what you need to understand. So classical pathway by antigen antibody, alternate pathway by bacterial endotoxin, lectin pathway by mannose binding lectin. They are the ones which will go and start the cascade, is what you should be sure. Right? Vikram Verma, good night. Take rest, have a soft pillow, good dreams, happy dreams. Array. Just go with the hope that half the questions will be what we discussed in the last 1 month. Definitely, वैसा ही होता है paper. Now, herpes virus family, Epstein-Barr virus. Molluscum contagiosum, pox virus, biscuit. Tinea solium's larval stage is cysticercosis cellulose, biscuit. Legionnaires disease lead to respiratory disease, biscuit. Typhoid में Vidal, Basu. First week blood culture, second week agglutination, third week stool culture, fourth week urine culture, agglutination होता है Vidal second week. Now gastric lavage. Contraindications. This is a standard question, doctor. Without that, there is no paper. Okay? So, gastric lavage is contraindicated in hydrocarbons. Jara mera bhi petrol is coming down, right? I am becoming a bit slow. Bear with me. But I want to lead you with example. I want to lead you with example. Lot of times students say, sir, आप इतना मेहनत करते हैं. So the whole idea is, imagine at 45, if I can be able to study, why can't you do that at 25? You guys, you can, right? So that's the reason I just want to lead you with an example. And always tomorrow when you do night duties also, remember, kabhi 36 hours you are stretching in the hospital. There are always opportunities to escape, but don't escape, because today you are working so hard ultimately to become that resident to do those night duties. The more we stretch, doctor, more become our resilience. That is the whole speciality of the humans, the little mortals. So, some of you were there with me since last January. Some of you are there with me from last August. So, I hope that what all that I could be able to spend time with you and can share with you and then inspire you to study, you are sufficiently inspired that tomorrow you will attack like Scud missile bombers, like Air Force pilots doing a surgical strike, and then come back. I'll be waiting for you all like Air Chief Marshal waiting for his young pilots to return from the air battle. Deal? Deal. That 24 questions फटाफट खत्म करके सो जाएंगे. Absolute contraindication for gastric lavage, corrosive, except carbolic acid, don't forget. Plus convulsant poison, volatile poison, upper GIT disease, they're all what, doctor? Relative. हमारा राजू तो न्यूक्लियर बॉम्ब डालेंगे बोल रहे हैं, बढ़िया पैसा रहना, right? हाँ. Now, doctor, study of birth defect is teratology. Confirmatory test for blood stain, spectroscopic test is confirmatory. एक सीमेन स्टेन, एक ब्लड स्टेन कल एग्जामिनर आपको दे देगा. So Castle-Meyer color test. It's fast and easy in the crime scene to test for the presence of the blood. The heme portion of the RBC reacts with the hydrogen peroxide to oxidize the phenolphthalein, giving it a pink color. So that is called Castle-Meyer color test. Phenolphthalein, hydrogen peroxide, pink, Castle-Meyer, heme. Bas. Right? Phenolphthalein otherwise is colorless, but in presence of blood and hydrogen peroxide, it will become pink. Wall scraping is used to treat. Hamma. Too much question ना? क्या वे इतना हमको कैसे मालूम होगा? कौन बनेगा पीजीपति? Oxalic acid. For me also, because I need to deliver a class to you, I know this, otherwise I too don't know. First time. It is a home available antidote to oxalic acid. Wall scrapings, right? McNaughton's rule, criminal responsibility of insane, which is a legal responsibility of insane. Two questions on same criminal responsibility. Curran's rule. डॉक्टर फटाफट बोलो, एग्जामिनर के क्वेश्चन बैंक में हैज ए रूल, मॉरिसन रूल, रूल ऑफ 9, सब कुछ है. वन वर्ड अबाउट ईच ऑफ देम. रूल ऑफ हैजे, इट इज फॉर एज ऑफ द फीटस. स्क्वायर रूट ऑफ क्राउन रम्प लेंथ, crown rump length in centimeters will give you crown heel length in centimeter will give you age of fetus. Crown heel length कल एग्जामिनर बोलेगा 16, so square root of 16 is 4 weeks is the intrauterine life. Rule of Morrison, what is it? Crown heel length of the fetus in centimeters divided by 5 will give you age in months. Examiner बोलेगा 40 centimeters, so 40 by 5 is 8. 8 is the age, that's called rule of Morrison. Curran rule. What is Curran's rule? My lord, accused person will not be held criminally responsible if at the time of committing the act he did not have the capacity to regulate his conduct to the requirement of the law as a result of mental disease or defect. Now, that means Curran says, at the time of killing, if the person has the knowledge what he was doing was wrong, but he does not have the capacity to control. He knows that I am killing, but he can't control that. That is Curran. Durham's rule क्या है? Accused is not criminally responsible if his unlawful act is product of mental disease or defect. लीगल वाले कैसे होता ना, लॉ को आंक नहीं रहता, खाली कान रहता, बुक रहता, बुक में जो लिखा है उसी को बात करता. कोई बोलता है कि प्रोडक्ट ऑफ मीन्स दिस दैट, द इंटरप्रिटेशन चेंज हो जाता है. तो इसलिए देयर इज अ लॉट ऑफ एम्बिग्यूटी. मेंटल डिफेक्ट क्या है, हु डिफाइंस इट, what type of mental defect, product क्या है. So that is the reason Durham's rule, product test is not useful. Then McNaughton, he also says the same, right? So rule of 9 क्या है? Small child में body surface area calculation के लिए rule of 9. Head and neck 18, anterior trunk 18, posterior trunk 18, upper extremities each 9%. Lower extremities each 13.5%, perineum 1%. Katham, rule of 9s. The rule which describes the cadaveric rigidity. What is the sequential onset of rigor mortis? Come on. Who will give me the correct answer? By elimination. फटाफट बोलो डॉक्टर. 213 ऑनलाइन. हम बहुत खुश हैं. This is a historical remembrance. So, very good. Everyone is saying Niston's rule. Nayamani, Bhavesh, Mahajan, etc. etc. So, Doctor, Niston's means rigor mortis does not start in all muscles simultaneously. बोला Niston. Shapira बोला rigor mortis mostly likely to develop simultaneously in all. Smaller muscles show smaller rigor, larger produce larger rigor बोल के Shapiro ने सोचा. But whatever it is, where does the rigor begin? Involuntary muscles, myocardium में first half an hour में. Then voluntary muscles. In the voluntary, eyelids. इसलिए सारे फीचर फिल्म्स में क्या करते, कोई मर गए तो आईलिड्स क्लोज करते. दैट मीन्स ही इज डेड. क्यों? आईलिड्स फर्स्ट टू स्टार्ट राइगर मोर्टिस. देन कम्स नेक, लोअर जॉ, फेस, चेस्ट, अपर लिम, एब्डोमेन, लोअर लिम, फिंगर्स, टोes. That's what you need to remember. And same order disappearance. So within 2 to 6 hours, eyelids, jaws stiffen. 2 hours, center of the body stiffen. Right? Now, Gustafsson तो without Gustafsson, नागरेड्डी साहब सो गए क्या? इंदिरा एंड नागरेड्डी. नागरेड्डी ने अच्छा दिया कल ने APS RTC. Right? I really liked it. APS RTC. What are the criteria? A is attrition, P periodontal membrane. Right? The different Gustafsson criteria. So T means transparency, etc. etc. So doctor, severe burn body, burnt body में sample कहाँ से? अरे नागरेड्डी साहब, good morning up. अभी भी you are awake. Meera is asking why FMGE 2018 paper, sir. As I already told you, NEETPG, FMGE, AIMS are like three sisters. right? If you are marrying a NEETPG, better have a date with the FMG, her younger sister, so that you will be knowing what topics her elder sister is good and going to ask you, right? So teeth. Now, doctor, इस मच्छर को रिकॉग्नाइज करो मेरे पुत्र, एग्जामिनर पूछेगा कल. Come on, who is going to give Ronald Ross Award for NEETPG? मिल जाएगा आपको. Identify this mosquito. Who is going to give me correct answer? So, who is going to give me correct answer? Yeah. Om Rishi is saying Anopheles. Indira, Amma, Indira, you are awake, huh? 1000 namaskarams. Good, good. Hope I am not spoiling you guys. Tomorrow if you feel sleepy in exam hall, मेरा जिम्मेदारी नहीं है. मैं तो अच्छा सोने वाला हूँ आप एग्जाम को जाने के बाद. टाइगर, नो टाइगर. इसमें टाइगर कहाँ है? यहाँ टाइगर कहाँ है? नेहा बेटे सोया नहीं क्या? गुड नाइट बोल दिया ना? हाँ, एनोफ्लस, फीमेल एनोफ्लस. डॉक्टर, ये टेबल है ना, जरा इसको ध्यान देना है, एग्जामिनर जरूर पूछेगा. टिपिकली लार्वे कैसे होता, एग ट्यूब कहाँ होता, which will be slanting while delivering egg, which will be lying down like this. So this is one table you have to be sure, doctor. Right? मुझे मालूम नहीं how you will remember. Right? Now, population covered by PHC in plains. Nayamani is asking, what is the use of knowing all this, sir? Because कल के एग्जाम में एग्जामिनर वन ऑफ द इमेज बेस्ड क्वेश्चन दे देता ये कैरेक्टर्स के बेसिस पे. Is it Anopheles, Aedes or Culex बोल के पूछेगा. That is the whole challenge, right? Laying the eggs in raft is the nature of Culex. Laying them singly is the nature of, laying the egg singly is the nature of Anopheles and Aedes. So Culex, it is like a polycystic ovarian disease. It will be laying in raft is what you need to remember. Culex के egg अंडे को floats नहीं रहता. Whereas it's a big story, right? But somehow you try to have a catch on that if you can. नहीं तो भगवान बोल के टाइगर दिख रहे तो एडिस, नहीं तो एनोफ्लेस लगा दो. Population PHC in plains 30,000. Best method for waste disposal when suitable land is not there is controlled tipping. When controlled, suitable land available, controlled tipping or controlled burial is very similar to sanitary landfill, right? In rural areas you can do this. So the solid waste is disposed into a duck pit is what you need to remember, and that is being covered with soil so that you are not attracting flies and rodents. Controlled tipping. So if you have suitable land, you can do that. Waist to hip ratio. When do you call? How much you call? Risk doctor. Punctual answers. आपका परीक्षा करो. Class कब तक चलेगा sir? Another 12 questions. We are almost reaching the end. If you are sleepy, please go to sleep. Don't lose your sleep. Good sleep is required when you are going for exam. Right now. Now, Nayamani is saying more than 0.85 in female. Absolutely. More than 0.95 men, more than 0.85 women is apple belly. Urban malaria scheme. What is not correct? So it comprised the vector control by intensive anti-larval measure. Urban areas with more than 50,000 population. Areas with the annual parasite index more than 2 is urban malaria scheme. So कल के एग्जाम में आएगा डॉक्टर, अर्बन मलेरिया स्कीम को 139 टाउन्स 19 स्टेट्स में इंट्रोड्यूस किया. All urban areas with more than 50,000 population. And slide positivity rate है ना डॉक्टर, examiner is trying to confuse you, don't confuse. Slide positivity rate more than 5%. Urban malaria scheme is introduced, not 10%, not 10 cases. That is what examiner is going to ask you. Now, DDT should be the insecticide of choice for residual spray. Now today what do we have? National Vector-Borne Disease Control Program. पहला मलेरिया कंट्रोल प्रोग्राम को 1953 में शुरू किया. 1971 में अर्बन मलेरिया स्कीम लॉन्च्ड. 75 में नेशनल फाइलेरिया कंट्रोल प्रोग्राम. एंड व्हेन डिड दे इंट्रोड्यूस नेशनल वेक्टर-बॉर्न डिजीज कंट्रोल प्रोग्राम? 2003 to 2004. What is the speciality of it? They have added dengue, Japanese encephalitis, Kala Azar, filaria control program and national anti-malaria program. ये सबको बंडल करके एक जगह पे NVBDCP बनाया. Got it? Who collects the blood smear for malaria? Blood smear for malaria. Male multi-purpose worker. So what is the role of male multi-purpose worker? Collect the blood smear, thick and thin, should be collected by him. Then female multi-purpose worker क्या करेगा? वो भी collect करेगा, मगर pregnant women के पास blood smear collect करेगा. Female multi-purpose worker. Sputum for AFP is collected at village level. I'm not very sure about this answer, doctor. अच्छा, हमारे अम्मा जी को पूछेंगे. नागरेड्डी साहब इसका करेक्ट आंसर दे दो. There is a little controversy, so that is the reason I'm asking. इंदिरा जी, आपका राय क्या है? आप तो बढ़िया मेडिकल ऑफिसर है. So what is your answer? इंदिरा जी और अम्मा जी नागरेड्डी. So, what is your answer? Is it definitely not medical officer? Medical officer तो अपने का ये sputum sample भी collect करने का नालायक होता है. हाँ, तो कौन होता है? Indira says actually Asha, but here health worker male करता है. I mean in this MCQ. अच्छा. So actually Asha. Okay. So I heard another answer also that आंगनवाड़ी वर्कर भी मैंने सुना. So इसलिए पूछ रहा हूँ. So health worker male for now, right? So you have microscopy center, primary community health center, district TV center. So सब सेंटर लेवल में मल्टीपर्पस वर्कर, विलेज लेवल में आंगनवाड़ी वर्कर, दाइस, विलेज हेल्थ गाइड, कम्युनिटी वॉलंटियर्स, they are the people who will deliver the drugs in directly observed therapy, dots में. ठीक है? So that's the point you need to understand. Active surveillance of malaria, who will do it? Multi-purpose worker. Because to do surveillance you need to know how to collect the smear now. Smear collect करना किसका काम है? Multi-purpose worker. Suraksha clinic is for what? Who is going to give me the answer? Question number 143. फटाफट बोलो बेटे. फटाफट बोलो. So Sheikh Mobina is saying it is for STD, sir. Very good. Naya Mani, IAS, is correctly saying Sexual Reproductive Health Services Suraksha Clinic. There are color coded kits for syndromic treatment of the STI. It was started in 1992. Its parent body is National AIDS Control Organization, right? And Ujjwala scheme. मेरे प्यारे भारतवासियों, फटाफट बोलो. Ujjwala scheme. Question number 144. What is your answer? कौन बनेगा PG पति? 144. What is your answer? Sheikh Mobina thinks child trafficking. संजय यादव क्लीन बोल्ड, राइट? अब सब लोग बराबर बोला. सृजना डाउट से बोला डी, मगर डी करेक्ट है. चाइल्ड ट्रैफिकिंग. उज्ज्वला is a comprehensive scheme to prevent trafficking and rescue, rehabilitation, reintegration of the victims of trafficking and commercial sexual exploitation. Sanctioned by Government of India. And there is one more Ujjwala scheme of Prime Minister Narendra Modi ji. महिलाओं को मिला सम्मान, स्वच्छ ईंधन बेहतर जीवन. स्वच्छ ईंधन बेहतर जीवन. महिलाओं को मिला सम्मान. Ujjwala scheme, there is one more thing to provide gas cylinders. Right? Now, death registration has to be done within 21 days. Within 21 days, it is made free of charge. नहीं तो late fee होता है. Under Vision 2020, school eye screening program में, if the teacher checks the vision of the student, he will refer him to training center or service center. So how is Vision 2020 का infrastructure, doctor? Primary level vision centers, their refraction is done, glasses are prescribed, primary eye care, school eye screening and referral service. Next, service centers. यहाँ cataract surgery, facilities for refraction, referral service. Then training centers. Tertiary eye care, training and continuous medical education. Center of excellence tertiary level में यहाँ professional leadership, quality assurance research, strategy ये सब होता है. बराबर? In the case of the measles, beautiful question. Post-exposure immunoglobulin can be given within how many days after exposure? फटाफट बोलो डॉक्टर. Within how many days after exposure? Who is going to give me the correct answer? 3 days. So you should remember, within 70, start after 72 hours and within 6 days of measles exposure. After 72 hours, within 6 days of measles exposure. Right? In case of cholera, how long you should isolate? Painful questions, these are all. 7 to 14 days. Highest contraceptive failure, obviously spermicide लगाए तो लगाने वाले को आना है ना, correctly लगाना. So highest contraceptive failure. For doctor, how many MTPs he has to perform before he can perform on others? 25 MTPs should be performed. RMP बोले तो हमारा RMP नहीं है, क्वैक नहीं है, registered medical practitioner है. 25 cases. उनके पास apprentice करना, certificate लेना. 28-year-old lady does not want to conceive, but she had a first trimester abortion. What do you want to use? IUD can very much be used. A woman from village delivers her 7th baby. She wants contraception. पोस्टमार्टम आईयूडी लगाना बोले तो कितने दिनों के अंदर पोस्टमार्टम आईयूडी ideally should be put, doctor? Early postpartum means up to 7 days. Up to 7 days, you can put the IUD. आ गया हमारा क्वेश्चन. Baba Baba black sheep, have you any wool? Yes sir, yes sir, I have a blue bag, black bag, red bag, yellow bag. Come on, tell me what is your answer? Very good. Everyone is saying yellow. Excellent doctor. ये तो ready है ना? इसमें डीला नहीं होना कल के एग्जाम में. Human anatomical waste, animal anatomical waste, soiled waste, chemical waste, microbiology waste, laboratory waste, yellow bag. Recyclable contaminated waste, red. Waste sharp including metals, white. Glassware metallic body implants, blue is what you need to remember. What is the most important step before disaster? Before disaster, not before NEETPG, before disaster. Mitigation preparedness. Mitigation and prevention, that is preparedness. Then prediction and early warning, फिर भी disaster हुआ. Then impact assessment. Then response, recovery, reconstruction. Jindagi में all disasters are like this only, right? That's the reason prevention is most important. So first step after disaster, अरे बाप. डिजास्टर के ऊपर कितने क्वेश्चंस आ रहे हैं देखा ना. सो डॉक्टर आफ्टर डिजास्टर इट इज रेस्पॉन्स एंड रिहैबिलिटेशन, रेस्पॉन्स एंड रिहैबिलिटेशन आफ्टर डिजास्टर, राइट डॉक्टर. वन मोर क्वेश्चन ऑन डिजास्टर. आई थिंक प्राइम मिनिस्टर ने कॉल करके एग्जामिनर को बोला डिजास्टर के बारे में डॉक्टर लोगों को तैयार करो बोल के. Which ministry for rehabilitation post disaster? Question number 157. 157. Give me one confident answer, doctor. Yes. Twisha Chakraborty and Sheikh Mobina. Everybody is right. Excellent, doctor. Excellent. गगन कुबेर ओनली इज सेइंग स्मृति ईरानी को भी जाओ. नहीं साहब, पुलिस को बुलाओ. होम अफेयर्स, अमित शाह should take care. So Ministry of Home Affairs coordinates with all state government disaster groups, National Disaster Management Authority, everybody. शांति 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 ही. मेरे प्यारे नन्हे मुन्ने NEETPG aspirants, you're all happy? पूरा पेट भर, दिल भर हमने प्रिपेयर हुआ आज. हम बहुत खुश हैं. एंड थैंक यू ऑल. इतना early hours of morning you came spent with Dr. Murli. My fortune, doctor. सीट क्यों नहीं आएगा देख लेंगे, कामयाब होके दिखाएंगे. Good night. Have a good sleep. Carry your common sense, confidence, coda equina. Don't worry about concepts, how much you read. Guilt to zero guilt, right? So, good night, doctor, and we will once more catch up tomorrow. As usual, Sa-ri-ga-ma pa-da-ni-sa. Once more, your juniors will be joining, and we continue the legacy of preparation. Good night.